Hello, builders. My name is G. Welcome to my show. Today, we have on a really amazing guest, a alumni of Techstars Boston, a queen of food as medicine, the most hardworking founder that I've ever met, and someone who's going to make a huge impact on the world. Eva Weinstein, welcome to the show.
Thanks for having me. Excited
Yeah.
to be here.
I'm excited to have you, and just want to ask, right? Labeled you as the queen of food as medicine. You're going to be working as kind of a industry leader in the space. So I just wanted to ask, what is food as medicine?
Yeah, so food as medicine has a few different meanings. It's beginning to be more well defined in the healthcare industry than ever before. It's also called food as medicine, food is medicine, sort of used interchangeably. But it's really the intersection of food and health. And it comes in many forms. It could be either providing people with actual food, whether that's medically tailored, whether that's through food prescriptions. And then also, nutrition education is a huge part of that, in the way that we teach people how to use food and how to acquire healthy food as well, to help them truly prevent and manage their chronic diseases and other types of health conditions.
And so, like, beyond like obesity and some of those diseases, how far does this cover in terms of like different health problems?
Definitely. So, food as medicine is throughout all of our lives. It's the way that we maintain a healthy life. And it also happens at different, life stages. For example, from an early age, teaching our children how to eat food and getting them more familiar with different textures and types of food can represent food as medicine, all the way to caregiving and elderly care as well, in the same type of way, just to meet patients and each other where we are in our life stage. So it can really happen from a healthcare perspective and also just a daily living and health and well-being perspective.
And obviously you're working on a startup in this space. And so what is Rewire Health working on? And what is kind of your particular and your team's vision for the future?
So I can't talk about food as medicine without talking a little bit about culinary medicine. So if you think of food as medicine as this broad umbrella of all the ways that we can help, create healthy lifestyle routines within people. One of those is, I alluded to a little bit, but nutrition education, and the way that we really help people find food, learn about food, and use that food. And that's really what culinary medicine does. It really is that combination of nutrition science with the actual actionable way of using that food. And so Rewire Health is actually a culinary medicine software. And we help healthcare providers as well as health organizations and community based organizations deliver more personalized, actionable, and effective culinary medicine and nutrition education to their patients. So that's what we do. We work, like I mentioned, with those healthcare organizations across the Northeast, as well as now across the US.
And, just knowing you and your team, how is it like working with your sister at Rewire Health? How is that dynamic and how is that like for you?
Yeah, so Olivia and I have been in healthcare for years in very different ways, which also really draw parallels to our strengths, and the way we kind of can fill each other out in terms of our backgrounds and what we can bring to the team. So it's been really great. I think working with a family member in general is daunting for a lot of people, but I think having early conversations right off the bat and just making things really easy just kind of helps, fuel a good relationship moving forward. And then in terms of our backgrounds, Olivia is a healthcare provider. She's a dietitian. A lot of what we're doing is stemming from her work as a dietitian and a lot of her ideas on how to solve problems that she was facing in her practice day to day. And for me, I have a background in healthcare, like I mentioned, but more on the commercialization strategy as well as product strategy side of things. So I spent a lot of time thinking about ways we could bring some of those ideas to market.
I'd love to know more about like you individually. Kind of what is your kind of founder origin story? Like, were you doing lemonade stands as a kid and all those, different founder tropes? Just love to know like where you got your start initially and then like where that kind of evolved to becoming a startup founder now.
Yeah, definitely. So I would say no, I'm not the typical entrepreneur at a young age, developing their first product or doing a lemonade stand and hustling. I've been very operations driven my entire career. I like systems and I like doing things efficiently. So I think, when I fell into the healthcare world, it was very much in a quality engineering, regulation, compliance side of things. And I get to use a lot of those skills like I did when I was a kid, in the same way as I like to put things into sort of like boxes and then create systems based off of that to really move things forward and really create new ideas that way. So anyway, I like to say I'm an operations person by heart, and that's how I was brought up as well.
And where did you go to school? And did you feel like kind of college and some of maybe your early work have set you up for your current work as a startup founder?
Yeah, I guess kind of back to what you had just asked to a little bit about growing up. So I might have not been entrepreneurial and maybe like the way of making money in the way of profiting, but I definitely had worked a lot of different jobs. And my sister would say the same thing for herself. We together had worked in multiple industries, both either together, kind of like tag teaming different roles, both working in a cafe and both being managers of that cafe, both working in patient care and doing, at home care for individuals as well together. And so I did that all through college. I went to Stonehill College. And I think that's where Olivia and I were both really tested with our resiliency. So having grown up with not a lot of money and being passionate about just trying to live healthy lives, but then also do that and survive, really made us who we are today. And so for Stonehill, my college, my alma mater, I did not focus on business. I focused mainly on healthcare. So I studied biology, thought I would maybe go to medical school, but universe had different plans for me.
Awesome. I remember when I was in high school going to a summer camp, and it would happen to be at Stonehill College. So I do remember that purple football field, and some of those, the great river in the middle of the campus, and all that great stuff. So one of the things that I kind of note, like both you and your sister have a background in healthcare, and I think healthcare is pretty notorious for being like very regimented and generally cautious for probably good reason, right? You don't want to really mess around too much with people's health. But how do you kind of rectify that and work within the typical startup culture about like moving fast and probably not in healthcare breaking things, but at least trying to work your way around the line in the sand and kind of exploiting new opportunities? Just wanted to get your take on how you work around that.
Definitely. I think healthcare is two things. It's ROI driven. I think to make any change, even if it's small change, you need to have a good case for it. But I would say that number one, so maybe that's number two. Number one is relationship building, just like any other industry. But healthcare, people in healthcare usually stay in healthcare. So ends up being a smaller world than you think. I think ways to kind of move fast is just know who your audience is and ways that you can sort of like crawl in a fast way, I guess, crawl up the sort of ladder of being a startup to get to the point where you're providing value that maybe an enterprise company would be providing, but really having to know the right people and just to get in the door and build those relationships super, super early on. But those relationships are folks that will, no matter if they leave that hospital or that healthcare system or health system or insurer, they'll stick with you and you'll be with them at the next one. So I think to move fast, you need to build relationships.
And so, kind of bouncing off of that, what do you feel in terms of different strategies? Do you think that it's direct sales, cold, emails, cold outreach, or is it general networking? How do you think is the best approach to kind of building up this relationship base that you can use to leverage in building your startup?
I would say trust and value-based marketing, but like really building that trust is important in healthcare because again, it's healthcare, right? We're helping people be healthy and just helping them, maybe cure disease or whatever it might be. You're helping someone's family member. So even if it's a provider you're talking with, like they also have to have healthcare. So healthcare is very personal to people. And so having a really, strong brand that people can trust and being a key opinion leader is really helpful. Providing value with trending topics. Like, for example, we use AI in our software, and it's important for us to explain to providers the way that we use AI in nutrition. because otherwise it could be really scary and daunting for a healthcare provider thinking that this type of AI may take over their job someday. So really having to build that trust. And then I would say with that, just, showing face, right? Like I think direct sales, a big part of that is just building relationships as well. So whether that be conferences is a really big part for, SaaS companies or enterprise, companies to go and work with healthcare providers or healthcare systems in general, conferences and places to show face and again establish that trust in person is always the best way. So I think at the end of the day they are enterprises, so you have to treat them like that. But of course it's a whole continuum of folks. So there's small practices as well. That's equally important though to build that trust.
Great. And I know that you're a graduate of Techstars Boston, and you and your team have been working within the Boston area. How is Boston to you, and how has that really affected your business, especially within the context of, working as a startup in the healthcare industry?
Yeah, I think the first year of starting Rewire Health, I did not leave my apartment. So actually, it was coming off of COVID, so a lot of us didn't leave our homes. But when we were able to, I didn't take the opportunity to network with the community in Boston, which I regret tremendously now. I think just having a group of people around like yourself to just offer support when they can is such a big part of building a business, because it's really hard. And I don't think we give ourselves enough credit for what we do. So Boston's been great. I think what's cool about Boston too is that there's a lot of folks who are kind of like transplants from other places. So they bring a lot of that network as well. So I've met a lot of folks in Boston who live here now, but have a strong network in New York and maybe in Silicon Valley as well.
I think this is always like a popular question, but, given a magic wand, how would you kind of improve the city and, specific to probably startups, although, if you want to, fix other parts of the city, I'm all ears on that too. But, if you want to talk about like within the startup industry or within the healthcare environment within the city, how would you say, given that magic wand, how would you go around and improve it so that you can build better solutions for people and make the biggest impact possible?
So for startups, I think if I could wave a magic wand, I would probably get any startup founder who wanted to go to a conference, I would get them there for free. I think one of the biggest barriers of networking is the fact that really valuable conferences are not just like a couple $100s, but like $5,000 to $7,000 per person. And so it's unbelievably unattainable for founders. And in a space like healthcare, where conferences is essentially like your go-to-market strategy, it's really hard. So I kind of wish that was more accessible to people.
Yeah, and maybe around the healthcare industry and how it can maybe interface better with startups, or maybe attract more innovation within the space and be stewards and support for innovation. How would you kind of magic wand improve those areas?
So you hear a lot about big tech companies partnering with healthcare organizations, but it's almost like you never see that on the ground. You really never see it actually in process or in progress. So I'd say, I don't know, if like Google, for example, Google Health is a thing. It's a big thing over the last few years. Like if they could kind of be on the ground a little bit more with startups, other than just kind of implementing startup programming, but like actually on the ground in each city and showing face that way, I think would make a big difference to, again, bridge that gap and then also help lend some support, right? Like that's a massive organization. What they say matters in healthcare. So
great. And so, kind of building on that kind of platform and base there, let's kind of talk about the future and look a little bit forward there. So in terms of like food as medicine in general, within the next, pick a time period, right? 5 to 10 years, choose a time period that you'd like that best represents it. What does the future of food as medicine look like? Especially when, in the news you might see talk about Ozempic and this, other pills and whatever medicine that might be coming out in that space. I think food of medicine is a different approach to looking at weight loss and, ways to tackle the obesity crisis and diabetes and so on and so forth. So, just would love to see within whatever time period that you'd want to select, what is kind of the future in food as medicine?
Yeah, as someone who's been both in pharma, medical device, biologics, and then now in healthcare technology, I would say all of these things have to happen simultaneously to provide the best care to patients at the times where they need it the most, and in a way that's most equitable and accessible. So I would say I hope at least Rewire Health has a big part of this, but just to really spearhead a future where people have access to equitable and accessible healthcare in general, right? And that stems from the food we eat and what we put into our bodies. So I think it really takes a multifaceted approach. And when you work with a pharmaceutical or a medical device, you need nutrition too. And that stems again from food, the food we eat. So it all has to come together. And I hope that does happen for people.
Okay, great. And where does Rewire Health fit in specifically with that future, kind of projecting within that same time period? What would you kind of say is, where Rewire Health, your team, where are you guys going to be situated in?
Definitely. Well, market research demonstrates that by 2030, the health and wellness market is going to be $8 trillion globally. So we definitely have a place in the market. For us, because we focus so heavily on nutrition guidance, if you will, we really can be that center sort of stage for a lot of these organizations like pharma, like med, like point solutions and digital health, to really have a foot in the food as medicine space in a way that's really scalable and attainable for them without having to, start from scratch building a state-of-the-art food as medicine solution. So we're going to be the sort of interwoven aspect of nutrition in the food as medicine space for sure.
That's really awesome. And, just wanted to say thank you so much for being on the show and kind of sharing your thoughts on a bunch of different areas within startups, within the city of Boston itself, and on, obviously, food as medicine. So I just wanted to ask, if someone wanted to be introduced to Rewire Health for a multitudes of reasons, whether to be a customer or to learn more about it for other reasons that we can't mention on the show, how can they reach out to both you and to the company writ large?
Definitely. So if you want to reach out to me, definitely go to my LinkedIn. I'm always looking at my direct messages. Also, Twitter is a great place. So my full name, Eva Weinstein. My Twitter handle, Eva W. Boss, BOS for Boston. And then for the company, we're at rewire-health.com. So you can contact us on our contact form.
Awesome. And my name is G. This has been my show. And always remember, if G can learn from amazing people like Eva, so can you. Thank you so much for watching.